Morning, everyone. Good to see you all. Welcome to the meeting of the Health Select Committee, Wiltshire Council's Health Select Committee on 22nd of January 2025. First of all, we'll move on to item number 1, apologies and substitutions. I believe we've had quite a few. Lisa, would you mind running through apologies?
Yep. We've had apologies from councillors Nick Dye and Howard Greenman, and from Irene Kohler, and from Fiona Slevin-Brown, Councillor Caroline Thomas and Councillor Richard Kluwer, and there are no substitutions.
I've also just been informed that Councillor David Bowler is unable to attend.
Okay.
Fine, thank you, Lisa. We'll move on then to item number 2, minutes of the previous meeting. Is the committee happy for me to approve the minutes of the meeting held on the 20th of November, 2024? Have a proposer for that, please? And I'll second that. Any objections? No, that's fine. Thank you. Declarations of interest. Are there any declarations of disclosable interests or dispensations granted by the Standards Committee? No. Okay. We will move on then to item number 4, Chairman's announcements. First of all, just on legacy. Obviously, we're approaching the end of this council, and we need to ensure that we're handing over to our successor committee. So having an opportunity for overview and scrutiny to look back on its activity during the outgoing council is an important part of the improvement journey. Doing so allows us to consider our successes and our challenges, and including the key activities we've undertaken. We can then submit suggestions for further scrutiny under the next council following the elections in May, and maximise the impact of its future activity. So at our next meeting on the 12th of March, we will receive a report outlining our key activities during the period 2021 to 2024, which will also propose some future work priorities for our successor committee after those elections in May. To feed into this process, members of this committee will soon receive an email from the Senior Scrutiny Officer asking you to submit your ideas on what scrutiny should be looking at under the next council. I'd be grateful if you could all give this attention and reply with a few ideas if possible. These will then be used to form a report to our next meeting in March, and ultimately to the first meeting of the Overview and Scrutiny Management Committee following the elections in May. Budget meetings. So you'll be aware you'll have had an invite for a meeting this Friday morning, 24th of January, where members of this committee will have an opportunity to review the budget as it relates to the remit of the committee. You'll have received an invitation to a Teams meeting. That meeting is taking place at 9:30 a.m. on Friday. And please do attend if you can. It's quite an important opportunity for us to be involved in the budget. There's also a budget briefing for all members today following this meeting. That's at 1:30 in the council chamber. Moving on then to item number 5, public participation. This is in Agenda Supplement 2, which you'll all have received. As you'll be aware, the committee has received 26 questions from 8 individuals, and it's all relating to one subject, and that's the new community health contract. These questions have been published as Agenda Supplement 2, as I mentioned, and this was circulated yesterday with a short statement on behalf of the committee. I'll just read that short statement out now. It is in the remit of the Health Select Committee to scrutinise how local health services are meeting the needs of Wiltshire residents and that they are effective and safe. The questions that have been submitted to the committee require a level of knowledge about the commissioning process of the new contract and transition of services that the committee does not have. We've asked the Integrated Care Board, as commissioners of the service, to provide a response, and members of the ICB are with us today. Caroline Holmes, Interim Executive Director of Place at Wiltshire BSW, is here now to give us a brief update on behalf of the ICB, and I believe that a full written response to the matters raised will also be provided. So at this moment, I'd like to hand over to Caroline. I'm just going to pause there, actually. Lisa, in terms of protocol, we have a statement submitted.
Yeah, deal with the questions first.
Deal with the questions first, and then we'll come to that. So I'll hand over to Caroline at this stage from the ICB to give us an update. Then we have a statement that's been submitted by Helen Nash. So I'm going to give Helen an opportunity to read out that statement. And then we'll have questions from committee, and then we'll move forward then based on the outcomes of that questioning process. So if I could welcome Caroline and colleagues and for an update, a verbal update at this stage.
Can you hear me now? Okay, thank you. So thank you, everybody. My name is Caroline Holmes. I'm the Interim Executive Place Director for Wiltshire, for Bain, Swindon and Wiltshire ICB. I also have my colleague Laura Ambler with me, who is the Executive Place Director for Baines within the ICB, and also Alison is with us today on behalf of Wiltshire Council. Just to clarify, the community health and care contract, the integrated community-based care contract, is commissioned by 5 organisations, our 3 local authorities in Bain, Swindon and Wiltshire, our ICB and also Somerset ICB. That's why you will see us sitting up here today. So, Chair, thank you for confirming the role and remit of the committee and for sharing the questions that have been submitted about the award of the BSW Community Services contract. We understand fully that people have further detailed questions and queries about the process we undertook and how we are working together with our partners to mobilise community services for the 1st of April this year. So we're mindful of the committee's time today, and we will supply full, comprehensive answers to the questions raised to this committee, and we will provide a briefing as agreed. These answers and the briefing will also be published on our website alongside all of the information that we've already shared about our work on integrated community-based care. We are confident that our innovative new community-based partnership with HCRG Care Group, the local NHS, local authorities and charities will transform the care and support that people get for their health and well-being at every stage of their lives. The decision to appoint HCRG Care Group as our lead partner followed a robust, detailed and legally mandated procurement process to ensure fair competition and best value for money. The mobilisation process has been underway since October and follows a detailed mobilisation plan with full risk assessment. The assurance of mobilisation is provided through the ICB, but also through all of our commissioning partners. Our focus continues to be on working closely with colleagues across BSW and all organisations involved to ensure a safe transfer of services for patients. We know that it can be unsettling for some affected staff, and we're working very hard with all of our partners to make sure that they have the right support in place to help them transition to these new arrangements. There will be opportunities as well to help shape the future of community-based care across Baines, Swindon and Wiltshire over the coming months and years. And we're looking forward to hearing from local people, communities and staff about their ambitions for the care they receive outside of hospital and closer to home. Both the ICB and HCRG Care Group have information available on their respective websites, and we're happy to share those links as well as we reply to the detailed questions in writing. Thank you.
Thank you, Caroline. So I'm going to open up to the committee now for questions. Actually, I'm going to hand over to Helen Nash, if Helen's with us today. Is Helen here? Helen, you've submitted a written statement. You're more than welcome to read it out. We do limit it to 3 minutes, but I think looking at the length of it, that should be sufficient. So I'll hand over to you to read that out, and then we'll open up to questions from committee. Thank you.
Do you want me to go to the microphone?
Helen, if you wouldn't mind coming forward just to the microphone so that we can.
Sorry, I'm Helen Nash. I'm a care coordinator working for Wiltshire Health and Care and a Unison steward, and I'm making a statement on behalf of Unison. The Health Select Committee has rightly recognised its role in scrutinising decisions that impact the health and well-being of residents. However, the recent decision to award the contract for community care services to HCRG raises significant concerns about transparency, accountability, and the committee's ability to fulfil its responsibilities effectively. This decision was made by the Integrated Care Board. Why then does the committee consider it appropriate for the ICB to scrutinise its own decision and compliance issues? This is clearly the responsibility of the Health Select Committee. This raises fundamental questions. How is this committee fulfilling its roles and responsibilities regarding this contractual award? How does it plan to ensure it has the capacity and authority to scrutinise decisions that have such far-reaching implications for the residents' health? Unison is particularly concerned about the potential for disruptions to patient care arising from this decision. As healthcare workers, we submitted key questions to the committee to gain a clear understanding of the risks and implications of transferring services to HCRG. Disappointingly, we were informed that many of these questions could not be answered due to insufficient information, which only deepens our concerns. This lack of transparency is deeply troubling, especially given the committee's duty to safeguard healthcare services from disruption. For the committee to effectively protect patient care and ensure accountability, it must have access to all relevant information about this transition, utilising its representative on the ICB board. To address these concerns, I urge the committee to exercise its authority and refer this matter to the full council, requesting a temporary pause in the transfer process. This pause would allow for the following: adequate information sharing and investigation. HCRG and the ICB must provide the committee with the necessary information to address our questions and offer a comprehensive understanding of the proposed changes and their potential impact on patient care. Furthermore, the Council should appoint a lead investigator to address these concerns, including the statutory obligation to produce a full business case and conduct meaningful consultation with the workforce via recognised unions. A thorough impact assessment. The committee must assess the potential risks and disruptions to patient care and put in place strategies to mitigate them during the transition. Evidence-based decision-making. The ICB should produce a transparent and detailed business case ensuring compliance with its roles and responsibilities while enabling the committee to make informed and accountable decisions. This is a complex and significant matter that requires thorough independent scrutiny to protect the health and well-being of residents. I strongly encourage the Health Select Committee to act decisively in the interest of transparency, accountability and patient care.
Thank you, Helen. Thank you for the statement. Caroline or Alison, do you want to, or Laura, do you want to come back on this, on any of the points made in that statement at this stage? Or do you want to include that in your written response?
Yes, I think we will include that in our written response. Thank you.
Okay, great. Helen, thank you for your statement. We've already had a statement from the committee as to our remit and roles. I'm going to open up to the committee now to address questions to colleagues from the ICB. David.
I do have questions, but I don't think it's particularly fruitful at this point to try to have a full discussion on this whole contract at this point in time when many of us only actually heard about the questions that were being asked yesterday. So what I would say to Unison is you've come to us very late. You knew about this last year, and it could have been you could have brought it to our attention then. It's too late at this moment in time for us to do what you ask, which is to demand a pause, because we've only heard in most brief terms the ICB's response to what you're saying. I did notice in what you are saying as Unison that you are questioning whether there was a proper business case, impact assessment and consultation on behalf of the ICB. I noticed the ICB's statement today didn't fully answer those points. I don't think we can get the drains up in this meeting and ask all those questions. I'd like to also know, what was the cost of these services when they were in the public sector compared to what the cost is going to be now, and what will be the impact on patient care. But I'm not asking you to answer those questions now, because I don't think that we can actually have a proper discussion and make a decision. What I would ask my fellow members of this committee is, do any of us remember the award of this contract being a dedicated and specific item for this committee? Because I don't. I don't remember this coming before us, an item that said award of community services contract by ICB. And we are the Health Select Committee. And it's £144 million a year, this contract. And our terms of reference include review and scrutinise any matter relating to planning, provision, operation of health services in Wiltshire, including any significant change to service provision. Require the attendance of the local NHS body to answer questions. Require the NHS body to provide information about the planning, provision, operation of health services. And indeed, report to the Secretary of State where the committee is concerned that consultation or substantial variation of development services has been inadequate. And I'd say that might actually be brought into play here. So I'm very, very disappointed that this huge contract award was not brought to this committee, which is the only democratic scrutiny for the people of Wiltshire over the services that we provide. And I think that the only thing we can do at this stage, because the contract is supposed to start on the 1st of April, is to ask the ICB to give us a proper briefing, as we should have had in the first place, to allow Unison to present their facts and to have a discussion about it. And I think we should have a separate, dedicated meeting of this committee to do that.
Thank you, David. Just to assure you that we will be requesting a full briefing on this for committee. Also, we can then, following the end of this session, we can then look at how we as a committee can undertake scrutiny of the transformation of services and the redesign of services to ensure that the intentions of the ICB meet the needs of our residents. So absolutely, we do have a further discussion to come to, but I think, I'm minded to say that we will have that briefing once we've seen the full written response. Yeah, I'm agreeing with you. But
My
yes,
suggestion is that briefing should take place in February or March. In other words, it should take place before this contract begins. A meeting. Yeah.
And then look, and on the back of that, if there are concerns in relation to the impact on services for our residents, we would then undertake either rapid scrutiny or bring it back as a full item to the meeting in March. But we can see how we go with this discussion before we formalise that process. Gordon, I'll come to you, but did the ICB want to respond to any of the questions within David's statement at this stage, particularly perhaps in terms of visibility of this transformation piece? I think that might be useful to provide the committee with.
Simple question is, why was this not brought to this committee? Why did the ICB not raise the award of this contract as an item to brief this committee on? And I know, that there will be an answer. I did see that in October we had an overview of the ICB strategy, a set of slides. It didn't mention this contract specifically. We've had other items which have mentioned, as Councillor Kidney said earlier, elements within this contract, but the actual award of this contract as a substantive item I don't think was brought to this committee.
Yeah, thank you for the question. So I think just to respond on that, what we had done was give an informal briefing about the process through your chair, because at that moment, as Caroline has outlined in our statement, we were in a mandated procurement process. That process included working through governance that was complex. It was with 3 local authorities and several ICBs. We are the lead commissioners. So the appropriate governance route was to include officers across the councils. Each locality had officers at each level of the governance, and the appropriate governance to take that through would have been the Integrated Care Board as the lead commissioner. It wouldn't have been appropriate at that time to bring it to this scrutiny committee, because the decision to award the contract was not for any one council or for any one scrutiny committee. We hear what you're saying, though, which is, if I understand correctly, what you're looking for and what you wanted to have had was an information briefing so that you can understand if there are going to be any impacts moving forward, and where is the role for this scrutiny committee moving forward in terms of scrutinising any transformation, any service change, and being able to help inform what potential engagement or consultation might look like. So I think we are very happy to accept the request to come along and do an information briefing. I can confirm that we have done an information briefing in Baines recently. So again, the same thing for that scrutiny committee. It wasn't taken there as a decision for contract award, but they have requested an information briefing, and of course we're happy to provide that from an ICB perspective.
Thanks, Laura. I'm going to hand over to Gordon now, who had a question, and then I'll come to you.
I don't have a question as much, but I think in addition to a briefing, I would appreciate a detailed paper outlining the changes and differences in services that people of Wiltshire might expect from the new contract. I think, you know, in a way, this has been in the shadows for too long, really, and in our memories, the only one that I distinctly remember anything about this was a paper to Cabinet on the 17th of September about a contribution from Wiltshire of £9.6 million in the Better Care Fund. Other than that, very little detail at all. And I'd like to thank Unison, really, for bringing this out of the shadows.
Thanks, Gordon. One of the things we'll request, I think, is perhaps sort of a very high-level overview of, because we have had briefings on the transformation process. We've had briefings on individual strands within that, Home First, various other bits. But I think for the benefit of a committee of ultimately lay people in this regard is an explanation of where this contract sits within that overall transformation piece, what all those different strands, just almost an organogram or something to give us a very clear illustration of where this fits with those other briefings we've had and those other strands we've been consulted on and we've scrutinised, if that makes sense. Councillor Cape.
Thank you. Thank you for the questions, and thank you for the comments. I'm going to start by saying that I absolutely endorse what Councillor Vigar and Councillor King have just said. My comment is based on the fact that I've worked in the NHS for pretty much my entire working life. I've been through a lot of reorganisations, changes of employment, contracts for work, seen commissioning, and I've seen health scrutiny committees look at the service provision, quality standards, and so on. But I have never experienced, and that might be an oversight, but I've never experienced health select committees getting involved in the commissioning process itself. Now, that doesn't mean to say that that should never happen, but I think it might enlighten all of us a little bit about how things have got to where they've got to. One of my concerns would be as the NHS increasingly, and I say the NHS in its broadest sense, my role is at NHS England, as the NHS increasingly commissions work from the independent sector. There have been, to my knowledge, some examples of where the pay in terms and conditions of employment have sometimes moved away from those as set out in Agenda for Change. I think that is an area that potentially I would want to see some assurance that is respected, and I'll leave it there. Thank you.
Thanks, Claire. Did anybody want to come back on any of the points raised by Claire?
Yeah, so in terms of pay parity, HCRG have clearly advised that they will be offering, well, certainly if I start with the staff moving into HCRG, they will move across on their existing terms and conditions. So they take that with them and their pension and so on. in terms of those other members of staff who join HCRG. They are planning to offer parity with NHS Agenda for Change pay scales and terms and conditions. And we can answer that question fully in the response because that's also led by HCRG Care Group.
Thank you, Caroline. Come back to David.
Thank you. Begging your indulgence, Chair. One last time. This is the last one of these committee meetings I will be at. Well, one scheduled ones. Hopefully, I'll be at another one because we'll have a special meeting on this issue. But can I also suggest that you as a committee return to this, perhaps in a year's time, because what we are seeing here is effectively privatisation, isn't it, of a lot of health service roles. I'm not saying it's necessarily a bad thing. I worked for the privatised BT and I think it was better in the private sector. I think if I was working in National Rail, I'd tell a different story. So sometimes it works, sometimes it doesn't. But I think, a report from this committee on privatisation of the community services 1 year on would be something that would be, that's the kind of role this committee has. It's not to get, as Councillor Cape says, it's not to get involved in commissioning. Shouldn't be getting, trying to get involved in the practicalities or in operational decisions that you make. Those are for you to make. Our role is to scrutinise, to make judgments and to make comments. And I think it would be good to come back to this once this contract has been in operation, because now it's too late to stop the train. All one can do is to say, let's make sure this works for the benefit of the patients who it's really in the interests of, and let's come back to it and see if it's worked 1 year after it's been implemented. Thank you for your contributions.
Thanks, David. And I agree. But I think we need to look at this not from we need to be careful not to be drawn into ideological matters of private versus public, because that's not our remit. Our remit are the needs of our residents being met. And I think it's crucial, as you say, that the committee next year, under the next council, does revisit this to ensure that those services are better than they currently are, because that's why we're here. The other thing to say is that it shouldn't just be in a year. We need to be involved as much as we can in the redesign of services as they're rolled out from April. So, I think we do need to have some scrutiny oversight of that redesign of services. And then in 6 months after that point, how is it going? Are the services better for our residents? Because that is our role. Caroline.
Apologies, I just realised my microphone was up. Just to explain a little bit as well, which I hope might help frame the response to the question, is just to explain that the contract that's been awarded is for HCRG to lead a partnership of organisations across BSW. That includes third sector organisations, but it also includes existing NHS organisations. So they, for some services, yes, staff will TUPE into HCRG, and some of those are the more clearly sort of recognised community services, such as community nursing, for example, and other services. But there are many elements of this contract where HCRG will enter into subcontracts with other NHS organisations. So they have been commissioned to develop a collaborative approach with partners. So they won't be directly providing all of those services. They will be developing a partnership approach. Thank you.
Thanks, Caroline. Committee, any further questions on this item? Okay, what I'm going to propose, therefore, and I'd like to do this formally as a resolution, is that we encourage a timely provision of the written response from the ICB to all the matters raised by Unison in their questions, and that we then have a briefing to this committee in February to brief us not only on the responses to the specific questions raised, but also to provide us with a clear overview of what this means in terms of the transformation of services for our residents, because ultimately that is where our concern lies. And then following that process, we can then look to how we're going to scrutinise that redesign of services and be involved in helping to shape that and ensuring that there is full engagement with users as these services are redesigned, because that is absolutely crucial. Caroline, you just want to come in there very quickly?
I was just going to say to try and be helpful as well, we do have some questions and answers already on our ICB website which address a lot of these issues. So outside of here, I'll make sure we give that link so that in advance of the briefing and the detailed responses, you will also be able to access those immediately.
Okay, thank you. And then, so sorry, I was sort of mid-flow. We will then see how best we're going to scrutinise this. It may be that we determine that we need to set up a rapid scrutiny exercise following that briefing, or it may be that it's just something we can track through standing items on the agenda going forward. So that's what I propose. Could I have a seconder for that, Claire? And any objections to that? No, in which case that's moved. I thank both Unison for your questions and for raising this issue with us. I thank ICB for engaging with us today, and we await your full response and that briefing in February. Thank you. We do move on to item 6 now, which is a cabinet member update. But unfortunately, I look around the room and I don't see any cabinet members. So we have had apologies from Councillor Jane Davis, who had an appointment this morning and will be joining the meeting later. So I will, later in the meeting, when Jane arrives, I'll come back to Jane to see if there's any update from her. Moving on then to item number 7 on our agenda this morning, the Older People's Accommodation Strategy 2025 to 2030. Now, this is an item that's come into committee at short notice. So as a result, I apologise, but there was no paperwork in advance. However, I do welcome the opportunity for committees to scrutinise the strategy at an early stage. Alison Elliott, Director of Commissioning, will be presenting, and then we'll open up to questions from committee following the presentation. Thank you, Alison.
Thank you, Chair. Can I also introduce Georgia Tanner, who's a commissioning team manager and who has worked on this in particular in terms of getting the views of our residents to inform our strategy. As the Chair said, this is a very early draft of the strategy, but we thought it was helpful to share it with you so you can see the direction of travel that we are taking from our commissioning perspective. So if colleagues are happy, I'll kind of whiz through the presentation. So we have worked with an organisation called Voice It, Hear It, and we commissioned them to do a piece of work for us to ask our residents what they wanted in terms of as we all age, but as they age, and what accommodation needs they predicted that they would have. So they talked to older people, but they also talked to a range of people, Georgia, a range of people of different ages, to try and get people to start thinking about what do they think they might need as they age. So the majority of people told us that they want to stay in their own home for as long as possible, but recognising that actually they might need practical support, they might need adaptations to be able to do that, people, and interestingly, I think we know this from our own experiences, things like being able to manage the garden and little tasks in the house. I know from my own experience that changing a light bulb, arthritis in my hands, changing a light bulb is incredibly difficult actually. So it's those small jobs and the things that we used to be able to do that actually do have a very negative impact on our ability to remain in our own homes, but also our feeling of independence and self-worth, really. People want accessible information about the housing choices and the options that there are locally, and they want equitable access to support with those housing options, regardless of their personal circumstances. Over half of the residents that we talked to suggested that their housing needs were likely to change. Whilst most people wanted to stay in their own homes, there was a recognition that they might well need to downsize. And people really wanted bungalows with small gardens. And I think that's always a preference for older people, isn't it? Living in a care home was the least desirable option for older people or for people considering their future housing options. And we know that most of our residents live in rural areas. Almost half of them, the respondents, lived in rural areas. And they're likely to need more practical support to remain in their own home as they get older. And that's in terms of, you know, being able to access essential support services. And there's a real overlap here, isn't there, between transport and access to facilities, especially health and social care facilities for older people in rural areas. So we have to take that into account, really. So that's what people have told us, and we know that actually people are living longer, and they're living longer, healthier lives, and that's a real positive. It's really good news, actually. However, if we're living with ill health and dependency, then that can be hugely challenging for individuals, their families, and for services. We know that the population is going to increase in Wiltshire by about 7% over the next 20 years, and the most significant growth is going to be in older adults. We know that by 2030, 8.3% of our population will be aged 80 years or older, and that's an increase of 29% from now. So that's significant. We also know that the working age population is going to shrink. So whilst we know that people wish to remain in their own homes, and that's what we want to do to support them, we also know that there will be an increase in those people with dementia. As we live longer, our risks of getting dementia are greater. And we know that from the work that we have done, that actually those with complex dementia may well require care home facilities. So our draft strategy takes on board what people have told us. We are also engaging with providers, and we will be engaging with our colleagues in health. But what we know is we need the right homes in the right place with the right support, so that people can stay independent and stay in their own homes. What we want to achieve is we want to give people easy access to information on both services and housing choices and options. Sorry, if you can move the slide on, that'd be great, thank you. We know that we need to involve people more in the planning of future accommodation, and we know that we need sustainable housing options to meet the current and future needs and aspirations of older people. And we need to ensure that we have support in the communities to enable people to live independently across all sorts of housing tenure. And we know that we need to ensure that, when I've been to committee before to talk about technology services, we need to explore with greater pace what technology can support people to stay in their own homes, and what preventative services should we be looking at now in terms of the younger generation to enable them to stay healthy and fitter for longer and less dependent on statutory services. So our commitment then, because that's what we want to achieve, so our commitment within the strategy is supporting community services so that people can stay independent, expanding the use of digital technologies, ensuring that more people are engaged with us as we work through developing this strategy and implementing this strategy, so that we can more fully ensure that we're assessing and understanding their housing needs. We know that there is a need to increase supported accommodation options for people with specialist designs for those people with the most complex needs. And we know that we need to ensure that there is accessible housing available, and we need to negotiate and work with developers to ensure that we are being able to support those people who are over 55, which I'm always horrified that over 55 is older, but there you go. We need to develop specialist residential facilities which promote independent living, but actually can manage those people with complex dementia needs. And so that's our issue really, is in terms of the market currently doesn't support those people with complex dementia, and that's what we have to develop. So Our commitment then is developing those additional housing options, a variety of different options, and certainly Georgia is exploring lots of other local authorities do things differently. So, you know, they will have often we live in big houses on our own as we age. There are examples across the country where older people will rent out accommodation within their home, and that person will also be their support. So there are lots of different ways to support people to remain in their own homes, but we have to understand that we are going to see that predicted rise by 25% by 2035 of those people who are over 65 and living alone. We can use different ways as well to support people to have choice and control over their lives. Direct payments, individual service funds, and wherever possible, we want to try and work with the current providers of care homes and nursing homes to make them fit for purpose for the future. But we recognise that often that is not an economically beneficial way to do it. So we do need to work with developers to ensure that we are developing innovative community-based homes that support people with complex needs. What we need to recognise, though, is often developers are looking at the self-funding market. They are not looking at the market from the council's perspective. We are competing with the self-funding market, and that is a big market for us to compete with. So we need to think differently about how we develop and build those homes and who we do that with, whether we develop with a strategic partner. You know, those are things that we need to consider as part of this strategy. So we need to ensure that also that we have a workforce. So we need to make sure we have the right workforce to provide support. And we need to work collaboratively with our area boards and our parish councils so that we are strategically looking across the county to make sure that where we can influence development, then we will try and influence that development. Okay, I think that's where we've got to, Georgia. So happy to take any questions. Thank you very much.
Great, thank you, Alison. Some quite eye-opening statistics there, goodness me. Any questions from committee? Gordon.
Good morning, Alison.
Morning.
Just the simple question, really. How best can we achieve change and development in that competition with that private market, you know, which will improve the offer for our clients and improve their living standards, really? How can we achieve that? Because that's talking high costs, really. Yeah.
Yes, so often the self-funding market will pay more than we will pay as a local authority for a bed in a nursing or a care home. So there are various commissioning and procurement opportunities to do that, which we have maximised in the past. So we have block purchased beds within a care home facility, for example, and get a better rate because we buy more. Obviously, there's a risk in that we then have to pay voids. So there are various procurement and commissioning mechanisms we can use. But as we move into the next 5-10 years, the issue that we've got is the fabric of those buildings, and the fabric of those buildings not being able to meet the needs of those people with complex dementia. So we are going to have to work with developers to build new. And it's about the relationship we have with that developer. So a strategic partner is one way of doing it. So the focus is on providing that provision for our people rather than for self-funders. But from an economic aspect, a provider will often require both. So unfortunately, the economics of it are the the self-funding market supports council clients. So in order for them to be financially viable, they would need both within their facility.
Supplementary, can we make them effective partners? with the
Yeah.
Private sector.
We have had effective partners before in this market. We can have effective partners in the future. We could provide them ourselves.
Thanks, Gordon. And just in terms of, I mean, something I've mentioned before when we've talked about this sort of thing is, what's the role of strategic planning in this? So looking at sort of local plan development, looking at larger strategic sites where, you know, should we be insisting that there's allocation of specialist older people's housing close to planned local centres within large strategic developments? You know, what discussion are you having with the strategic planning team to ensure that's sort of built into that strategic planning process?
So we are constantly having conversations with planning, and so they do know our requirements for the future. One of the challenges we have is we can't insist that provider A provides care home facilities for our clients unless we're in a strategic partnership with them. So, you know, Acme provider comes and wants to develop on a site and planning say yes. We can't insist that they only sell to us. So we have to have that strategic partner relationship first.
Thanks. Claire.
Thank you. Thank you very much for the presentation, which was very helpful. I think what I was going to say is building on what Councillor Kidney has just said. Were you consulted on the local plan at all? You were, definitely. Because I think that's
Yes, we
really important that we know
Yeah.
that did happen. Thank you.
Thanks, Claire. Any further questions from committee on this item? Yes, Pip.
I was going to ask for your consultation exactly how many of these people you consulted and what the response rate was. Do you have those figures? Because I'm over 80, I wasn't asked.
We didn't ask everybody, Pip. Okay.
Ah, well, because I know when it was done a few years ago for my parents, and other elderly relatives, one said stay home, the other two said go into a care home.
And people will have different views, but all the work we have done around accommodation over the last few years, the care homes being the least favoured option has been consistent. So we know that people want to stay in their own homes.
Yeah, but what I'm asking is what percentage of over whatever the age was that you asked the question actually responded?
So I'm going to ask Georgia to answer that question.
Thank you.
But just so members of the committee are reassured, this was the first piece of consultation about this specific accommodation strategy. We will continue to work with our residents to make sure we get it right. So it's not a once and done. This is what we call a co-production. So we will continue to work with our residents to make sure we get it right. Sorry, Georgia.
Thank you. So there was 165 total responses, and that was through survey and also engagement sessions, in which the majority of adults were between the ages of 25 to 63, and then 37% of those were over the age of 65. Majority of the respondents were women, and half of the respondents had identified that they had a disability of their own. And then also, over half of those people were already in social housing, and then 32% of those lived in their own home.
Very small percentage. Based on what you put up there of the numbers that are, you know, over 80 and over 60 and over, and of course this is an ongoing.
So the numbers about the population do not come from this, okay? The numbers about the population come from our work with public health and our data that we have in terms of predicting the future demand that's coming in. So yes, small sample PIP who responded, but as I say, the first of many, okay? So we will engage with many more people as we go through this.
Thanks, Pip. David.
So just following on from Pip, something that occurred to me earlier, but I will ask it. So what is the catchment area, as it were, for this work? What's the constituency? Are we talking here about people who've been assessed as needing care under the Care Act? So the ones who are our customers, as it were, of all adult ages? Because I noticed you were interviewing people there who were like under 55, you know. So we're not. So to get this right, we are talking to everybody who is within the adult social care remit, as it were, who's been assessed as needing care under the Care Act as adults, but we're not talking to older people who have not been assessed. Is that correct?
No, so we were talking to anybody, so you didn't have to be assessed. Okay. We were talking to anybody. But the reason why we wanted to talk to younger people as well as older people is because it's one of the things we don't do terribly well, I think, in this country is think about what it's going to be like when we're old. Yeah. And what we were trying to do is get people to think about actually what might that look like? What might my needs be like? Because what we want to get better at is planning over a longer term. So not planning for next year, but planning for the next 25 years. So what are today's 40-somethings going to want or need when they get older? So we don't, if we're going to build something, we want to build it that's future-proofing it. So it's important to get those people thinking about what their needs might be, getting those people talking about what they think their accommodation might be to help us in that planning process. But we will continue to talk to those people of a wide variety of ages as we go through this process. One of the things that's important, though, is what we're looking at support for those people who have been assessed as being eligible under the Care Act for support. Yeah. Yeah.
Thanks. Claire.
Yeah, one other question, if I may. Sorry, I don't think I nodded. It's all right. Okay, good. Yeah, thank you. This is all very helpful and interesting. My additional question, we see a lot of residential accommodation coming forwards that is specifically for the age group of over 55s. And some of those work out to be pretty expensive, frankly. Is that a model that your team sort of recognises and supports, or are there other options that you would prefer to see? I'm thinking of places I've seen elsewhere in the country where developments have a very mixed age group, and younger people are able to engage with older people and actually create what appears on the surface to be a much sort of healthier way of life. And I just wondered if that was something that you'd had feedback from your consultation either way, and whether you'd care to enlighten us on that. Thank you very much.
Do you mind if I tack a supplementary onto that as well? In terms of that specialist over 55s accommodation, presumably there's no reason why, in terms of the overall affordable housing provision for a set strategic development, couldn't include a proportion of affordable housing being provided within an over 55s development. So in other words, the developer would have to provide a proportion of that over 55s that would be taken on by the council as part of the, say, whatever the percentage of affordable housing is.
Yeah, that could be the case. I think one of the things and I won't go down the because affordable housing is only affordable the first time it's sold. But I won't go down that road. But in terms of your point, Councillor Kate, so absolutely what we want to do is look at that intergenerational opportunities, what we find difficult and older people that we've talked to find difficult is that kind of older people's village, if you like, kind of ghetto. So we are looking at sites currently where we think we could, because fortunately commissioning in Wiltshire Council is across children's and adults, so where we think we could perhaps, you know, build a nursery, build a care home, build accommodation for general needs housing, but also what we do desperately need is working age adults accommodation, so for people with a learning disability or a mental health problem. So are there opportunities to mix so that we are creating that intergenerational community, which is, I would agree, much healthier.
So I appreciate where we are with the local plan, but is there any way you could sort of steer any kind of policy around that in, because otherwise we're just going to keep seeing more and more and more of these over 55. And I'm an old person now, so I can call it an old person's ghetto because I am one. Thank you.
I'm glad I found somebody else who doesn't want to live in one. Yes, I mean, we have the local plan. That's really important for us as a council and for us as a county. But we continue to work with our colleagues in planning and in assets and look at opportunities for a variety of developments. We're also looking at where we've seen extra care facilities being built elsewhere. Some of those, as you quite rightly say, are mixed tenure. So some will be rented, some will be purchased. You know, some of the kind of big nationals like McCarthy Stone charge a lot of money for those, and the services charges are huge. That would, you know, exclude our people, if you like, the people that we work with in Wiltshire. So we're not supporting that kind of development. But is there an opportunity for that extra care facility to not be focused on over 55s actually, but be focused on younger people with a learning disability or a mental health problem? So we're trying to be as creative as we can, but this is really helpful feedback in terms of this development of this strategy, because it is a draft. So thank you.
Thank you. Will there be a delivery plan for the strategy in due course?
We have a delivery plan for every strategy, because a strategy is no good if it hasn't got a delivery plan. We can write the best strategy in the world, but if we don't monitor actually the impact of it, then we're wasting our time. So yes, so we can bring that back to committee when we have finalised the strategy and the plan.
Super, great stuff. Any further questions on this item? No? Thank you. In which case, I'll move a resolution that we note the development of the older people's accommodation strategy, and that we request that the committee does have an opportunity to review the strategy's delivery plan in due course. I have a seconder for that. Thank you. Any objections? No, let's move. Thank you very much, Alison, for the update. Move on then to item number 8, continuing healthcare funding in Wiltshire. The committee received an introduction to continuing healthcare funding in June last year, and we requested an update to include Wiltshire-specific data. The presentation is included in the supplement, pages 3 to 8. Sarah Jane Peffers, Associate Director of Patient Safety and Quality at ICB, will present the item, and then we'll open up to the committee for questions. So, Sarah Jane, who I believe is joining us online. Yes, see you there. I'll hand over to you. Thank you.
Thank you, Councillor Kidney, and thank you very much for inviting me back. As you rightly said, I was with you in June of last year, I think possibly in the sunshine of Wiltshire and now in the grey clouds of today. However, I hope I will give you a positive update following that initial conversation in June. I will go through the slides as is, and then, as you say, I will welcome any feedback from yourself. You probably have noted throughout the short presentation that there's information here from a BSW perspective, and then some data for Wiltshire in particular, recognising that a lot of data now that we present is as BSW, that is as expected as we present this information nationally. So therefore there is a limit to some of the granularity that I can offer today. Okay, so just to give you a brief overview to start with, I'm sure many of you know this already, but I just want to confirm the statutory context for BSW ICB. So ICBs have a statutory responsibility for assessing individuals for eligibility for NHS continuing healthcare funding. The National Framework for NHS continuing healthcare and NHS funded nursing care sets out the principles and processes to be followed by ICBs, and this was revised in July 2022. So we're working with guidance. It's about 2.5 years old at the moment. So the aims and benefits of CHC funding is that it is a package of care provided to individuals who have been assessed as having a primary health need. It is fully funded by the NHS and aims to support individuals with significant and ongoing healthcare needs, enable care to be delivered in the most appropriate setting, whether at home or in a care facility. So in front of you here is a number of graphs, and I'll just run through those graphs with you now. So the proportion of assessments resulting in CHC eligibility in Wiltshire compared to national conversion rates and nearest neighbour conversion rates. So what you're actually seeing in front of you here is BSW data, but hopefully you can see from all of that information that we do currently benchmark within the confidence intervals as set out by NHSE. So in the top graph there, that demonstrates BSW within the confidence level of individuals assessed as eligible for CHC per 50k nationally. What the lower graphs show is us against our nearest neighbours. And this is what's probably more important, because when we talk about nearest neighbours, we are therefore compared with systems that have similar demographics to BSW. So in this graph, you'll see that the graph below shows comparative positions with BSW's nearest neighbour based on demographics, which again demonstrates BSW ICB being within confident levels of both receipt of new referrals for CHC per 50k and the number eligible for CHC per 50k. The proportion of assessments resulting in CHC eligibility in Wiltshire compared to regional conversion rates. So again, whilst apologies, I put Wiltshire in the title there, what I'm presenting here is BSW level information. And what's really positive to take from, particularly from the table in the middle, is the referral conversion rate and the assessment conversion rate. We've got a 19% referral conversion rate and an assessment conversion rate of 22%. Now you can see in comparison with the rest of our regional colleagues, we fare well there. But what's important is where the percentage change between, as I say, that referral conversion rate and assessment conversion rate. That shows that we get good quality referrals coming into the assessment team. And that shows the close collaboration we have with our local authority colleagues predominantly, who tend to be referring in for CHC assessments. Obviously, there's a wider stakeholders as well, but obviously it's important that we work closely with our local authority colleagues. What's also really positive news is that we are BSW ICB has exceeded the 80% target of assessments being completed within 28 days of notification. And obviously that's the aim that I presented to you in June of last year, but we hadn't hit that target and we had been below that target for quite some time. But we have now hit that target consistently across 2 quarters. This, I believe, is Wiltshire data, and this is the data that we do have available to us at this time. And this is also comparable data with Baines and Swindon. So the continuing healthcare dashboard captures, as I say, the granular data for our localities. Wiltshire has approximately the same population as Swindon and Baines combined. I'm sure you know that. Data reflects the previous slide reporting of a 22% conversion rate for eligibility for Wiltshire residents. So that's good news, and data also reflects a reported increase in positive checklists, which have been a sustained increase over the past year in all 3 localities. And that the bottom table there just shows that difference in the referrals concluded within 28 days. And so I can confidently say also in Q3, we hit over the 80% target. You also wanted me to present our financial position. So Wiltshire locality CHC patient spend equates to 52%, 52.5% of BSW ICB expenditure, at 36.76 million from a total of 70.07 million to date. So a good spend there for our Wiltshire residents, but obviously that reflects the higher number of referrals and assessment, positive assessments that happen in the Wiltshire space. And BSW ICB adult CHC spend in comparison to our nearest neighbour based on demographic similarities reflects the second lowest annual budget. And obviously happy to pick up any questions there. So this is a slide that I shared with you last time, and this tries to capture our transformation journey. And hopefully you can see from the data that I presented today, we are showing positive steps to transformation for CHC for adults, but actually across all age continuing care. We have now a better offer for PHBs. We are in the process of mobilising a new end-to-end IT solution for CHC, and that will enable both patients and our partners to interact with us through an IT solution. That hopefully will again expedite all decision making that we have to make throughout the processes. We do have shared policies, and importantly, we have a joint funding policy that does enable us to work with our local authority colleagues if somebody is not found eligible for CHC but still has healthcare needs. And that's important that we continue to work, as I say, with our local authority to ensure that we make the right decisions for our individuals and ensure the right funding streams for those individuals. And we are consistently looking at our own workforce within the ICB and to enable us to ensure that we have a competent and confident, knowledgeable workforce to ensure that we continue on this transformation journey and ensure that the right people get the CHC funding in the right timeframes. So I will leave it there, but happy to take any questions from yourselves.
Thank you, Sarah. Committee, any questions? Gordon.
Thank you very much for the presentation, which is very clear, clearly put through. But it's really about how we convert people into the service and what the cost is and everything like that. We talk about eligibility, you know, but there are lots of questions around eligibility, which is not really addressed in these things. You know, how do we ensure fairness, for instance? How do we ensure that, you know, that those people who are deemed to be eligible are a good cross section of all groups within society, or that no particular type of person is left behind, as it were. So you know, so what about all of the ethical things which come with running a continuing health care model? Thank you.
Would you like me to answer now, if I, Councillor? Is that...
Yes, that would be nice.
Yeah, okay. I think you bring up an absolute valid point there, because we absolutely have to ensure that we've got equity and fairness across all of our populations in Wiltshire, but also for us across Baines, Swindon and Wiltshire. I recognise I didn't present that information today, and I can do so in the future if I'm invited back again, because it's important, as you say, to be able to clearly articulate that we are offering fairness and equity. Obviously, we are reliant on ensuring that we work with all partners across health and care to ensure that the right people are recognised for CHC. The bar for a positive CHC checklist is set low to ensure that we can offer as many people as possible a CHC assessment. And that has been reviewed multiple times, but it importantly has stayed low, as I say, to ensure as many people as possible get the opportunity of a CHC assessment. But as I say, I know today I haven't provided you with any of those demographics that could challenge our fairness and equity. And that's something that hopefully with the build of a new end-to-end solution, we have opportunity to gather that data, and I can present that at a future date.
Thank you very much. The access to anything is an important ethical issue, and you know, seeing that data would be very helpful.
Thanks, Gordon. Sarah, in the presentation, you referred to confidence levels for receipt of referrals and eligibility. What does that mean? What do you mean by confidence levels?
So the confidence levels are set by the national our national team in NHSE. So that is enabling us to compare ourselves with everybody, both nationally within our nearest neighbour and locally. And that I believe that what that's showing you is that we ourselves are therefore converting the right number of people from that referral to assessment, and actually the right number of people from assessment into eligibility for CHC. So it's a comparable number, as I say, nationally, and it's always based on 50k populations.
Okay, and I think David's got a follow-up question.
Well, just to check on that, are you using confidence in the statistical sense there, rather than you're not talking about the confidence of patients in the service, you're talking about the confidence you have in your own data?
Sorry, yes, yes, it's all based on statistics, yes.
Okay, thank you. Any further questions? Oh, yes, Councillor Jane Davis, a cabinet member, would like to come in.
Thank you very much for the very interesting presentation. It is complex information, and I was pleased to hear the question around confidence levels, because I was wondering, looking at the slide with the green writing on, not the final slide, but the penultimate slide. And you say in there that BSW ICB adult continuing healthcare spend in comparison to our nearest neighbour based on demographic similarities reflect the second lowest annual budget. I mean, I think we're just about 8 million above Northampton, but we are very significantly below East of England, for example, which has over 100, nearly 110 million spend annually on that. What do you think accounts for that?
I think that's a really good question, Councillor, and I think, I think this is multifactorial, if I'm honest, and I don't think that's necessarily, that shouldn't be seen as a poor indicator for BSW. Obviously, you know, we want to ensure that we are giving people the right care according to the assessment. That's absolutely vital, and we want to ensure that we keep the person at the centre, and we want to ensure that we therefore offer personalised care and offer as many people the opportunity to deliver that care through the mechanisms of personal health budgets. So we have a significant number of people with personal health budgets, and that is a good thing, and we're obviously trying to encourage that as well. We're obviously also we work alongside our local authority colleagues to ensure that we're using care providers and care homes a lot within the framework that you have as a local authority, to therefore ensure that we have the most effective care provision across Baines, Swindon and Wiltshire. And that's not only through the lens of finance, that's through the lens of good quality, safe care provision as well. So I don't think that's what's important, is that we are assessing the right people, so we get the right numbers of referrals and we get the right numbers of people found eligible, and we work with our local authorities to ensure that we offer personalised care and care that is safe and effective to all of those individuals. So I think it's multifactorial, but I don't think that indicator is an indicator that we're not doing the right thing.
Okay, thank you. In terms of the transformation that you describe in the final slide, what does it look like at the end of the transformation? What does the service look like? What are the outcomes of the transformation?
Thank you. Yeah, that's a very good question, isn't it? But so I suppose first and foremost, I will keep sort of repeating what I've said earlier, is that we need to ensure that the right people get referred and the right number of people get assessed for CHC funding, and that's important that we do so, and therefore the patients have a good experience. So it's important that through the transformation and through all of those pillars of transformation, we are measuring positive outcomes. So we want to see that we maintain our standard that we've met, that people have the right and timely assessments, that people are offered personalisation, patient choice or service user choice. So we need to increase the numbers of people on PHBs so we can really ensure that people have personalised care. We have to ensure, going back to sort of Councillor Davis's question there, we need to ensure that we are financially effective in all that we do to ensure fairness and equity for service delivery and for obviously the people that we serve. So they're the main aims that we're aiming for. As I say, it's all about ensuring the right people get assessed, to ensuring that people are kept at the centre of decision making, and that we offer personalised care through an increased use of PHBs, and to maintain the standards of delivery at the moment, which is ensuring that everybody gets assessed within the 28-day target.
Okay, thanks, Sarah. What's the appetite amongst committee members for further scrutiny on eligibility? Yes. Yeah. Grand. Okay. And Sarah, in terms of further scrutiny, would it be possible to have more Wiltshire-specific data?
Yes, that's what we're aiming for. As we transition to the new end-to-end solution, then we will have a better ability to pull more information through that is Wiltshire specific. That goes live in April, so I'd like that to be considered, because I want to ensure that we've got a robust system in place and I can start to pull that data and come with valid and reliable data.
Great. Okay, thank you. Claire.
Thank you very much. And again, thank you for the presentation. I've got one further question, if I may, on that last slide. And there's a lot of helpful outcomes or ambitions there. I guess there's an undercurrent in there, not expressed, that we would probably want to know if true, that the whole thing gives value for money within the context, obviously, of delivering good quality. Thank you.
Thank you. I note that point, Councillor, and I'm sure that is reinforced in any further presentation I give to the committee.
Thank you. Any further questions from committee? No, in which case we have a resolution that we will receive a report annually on continuing healthcare funding to include eligibility breakdown, and that we carry out rapid scrutiny to determine the information required around eligibility and request Wiltshire specific data going forward. Do I have a seconder for that, please? Thanks, Gordon. Any objections? None. Okay, Sarah, thank you very much for your time this morning and for the report, and we look forward to updates in due course.
Thank you very much. Thank you for having me.
Thanks. So we move on then to item number 9 on the agenda, which is progress of neighbourhood collaboratives. You can find this on pages 35 to 46. This is an update on the neighbourhood collaboratives, which last came to the committee this time last year, January 2024. Thank you for the report, which I say can be found on pages 35 to 46. And Emma Higgins, I believe, is with us, head of Combined Place at ICB, to introduce the report. Emma, I'll hand over to you. Emma's joining us virtually. Thank you.
Thank you, Councillor. Those of you that don't know me, I'm Emma Higgins. I'm head of Combined Place for BSW ICB, and I'm here to present the report on the neighbourhood collaboratives, which was an action and a request from a previous meeting. So the report provides an update on our progress and key learnings over the last year. It offers an overview of the progress and challenges in establishing the collaboratives across the area and highlights the learning from our pilot projects, particularly the livestock market work in Salisbury, as I was requested to give a particular overview of that and outline some of our steps and plans for the future. We've made significant strides in several areas. In Chippenham, Corsham and Box Collaborative, for example, we've completed the launch programme and an initial engagement set of work. Our focus is on a targeted cohort of residents to measure the impact of our prevention-focused work that we're co-designing and co-developing with them, and that's focused on people who are at risk of developing high blood pressure in certain parts of the community. In the Salisbury Collaborative, I've already referenced the livestock market, and we've taken quite an innovative approach by engaging the farming and rural communities in that work and the development of health and wellbeing support within that market directly, and that's been particularly successful. And there are ongoing discussions around work in that space and transferring the learning to other settings. In terms of our county-wide progress, despite some delays to the original aim of the April 2025 deadline, or target, I should say, rather than deadline. Recent developments in Warminster and Calne and Trowbridge and Devizes are really promising, and we're on track to establishing collaboratives in those areas and across Wiltshire during 2025. In terms of community conversations, and I was asked specifically about that point as well, colleagues in the community conversations team at the council are embedded in the collaboratives work, and their ongoing dialogue with communities has been really crucial in shaping our priorities and ensuring our activities remain responsive to local needs and walking through that together and being present in each other's work. In terms of key learning, particularly around the livestock market, Salisbury, in that Salisbury area, that's provided invaluable insights. By offering health promotion and some services directly into the market, we've successfully engaged traditionally hard to reach rural populations and both supported people with needs that were identified in the market and raised people's awareness of their own ability to affect their own well-being through preventative actions. The pilot highlighted the importance of delivering services in familiar environments and demonstrated the value of preventative care. There is a whole evaluation report and a set of slides if anybody would like to see more detail and more information on that. In terms of moving into the future, into 2025, we aim to embed the learning and the approach from our collaboratives across our work. A full steering group meeting in February will focus on lessons learned throughout the work to date and celebrate success to inform future developments. And we're also, of course, exploring opportunities to integrate the work with the new ICBC provider in HCRG when that comes into effect in April. So in conclusion, the Neighbourhood Collaboratives programme has made significant progress towards the objectives. It demonstrates the potential of community-led, partnership-driven approaches to improving health outcomes and tackling health inequalities across Wiltshire. And it's not a unique programme in that sense. I want to make sure that I sort of recognise that we're drawing on all of the learning from a lot of work that's happening in a lot of places, including community conversations. And we look forward to further discussions on how we can build on all of those successes and address those challenges together. So I'm very happy to take questions or comments that you might have on the report. Happy to answer or address any of those now. And of course, I'll come back and feed back to any that I can't immediately address. Thank you.
Thank you, Emma. So I'll open up to the committee for any questions. And actually, are any members of the committee involved in neighbourhood collaboratives or the development of those? Yeah, Gordon is. Yeah. Gordon.
Morning, Emma. As I look further into this neighbourhood collaboratives with the livestock market part, because that is a bit of a special case, you know, with communities looking at trips and falls and hypertension, diabetes, or onset things like which are services already available in the community, how can a collaborative actually prove to be a success or even measure its worth?
Thank you, Gordon. So you're absolutely right. In many of the areas that we are working, some domains, if you like, where we're working, there are services that exist to support people with those conditions, with those concerns. What the work of the collaboratives is really focusing on and being led by the people that live in that area and responds to the local data that we are sharing and the indicators that are flagging the types of problems that we want to address in each neighbourhood. We're looking to prevent the need. So for falls, you've referenced that example, for example. So in Melksham and Bradford and Avon, we know that our services need to respond to more falls in that area than in other areas, disproportionately so. So we get more ambulance calls, that call outs, more urgent GP appointments or requirements, and more demand from our 2-hour response services to go out to attend people's homes for those reasons. What the collaborative is seeking to doing is to prevent people from falling in the first place. And so that is the area where we're seeking to work. And so there's been a lot of work, and I understand that that's proving quite successful. So that's but you're right, in terms of proving the value, proving the worth, that can be more challenging because in essence you are measuring the absence of something, although it is measurable and it is more long term. So you won't necessarily see immediate improvements in the data coming through. But there are all of our partners, and I can share other evaluation reports expressing the value of all of that work to connect up services and organisations and individuals and community groups. And that work is mushrooming outside of the groups themselves. So there's a lot of value in connecting people together and having what we call line of sight. So recognising who is working on a similar thing in a similar way to you in your own locality. And there is a lot of value in that too. So that's one example. I hope that's helpful.
Yes, it was. Thank you very much.
Thank you. Any other questions from committee members? No. Just a question that occurred to me, Emma, was that I think it was cited in the report that the lack of resources and funding for participation are identified as being key challenges. Are there strategies that have been identified to overcome these barriers?
To some extent, yes, and to some extent, completely, the collaboratives were always designed to be self-sufficient and to be a repurposing and collective sharing of our resources. So they were never meant to be funded separately and to have new funding come into them. Of course, as demand and capacity has been challenged over recent years, that has become more and more of a challenge in itself to maintain. Despite a lot of goodwill in that space. So one of the things that we've done as a group, as a collective group of partners, has been to identify other sources of funding and to bid for funding. So we've had 3 or 4 successful bids, which we would otherwise not have been able to do. So we've got our VCSE partners in as part of the steering group, for example. They're really experienced in bidding for work and really well aware of opportunities for funding. And so we've been successful in looking at some of those. We've bid for health inequalities funding, and we've been successful in having a bid through there. And we've used some research funding. We got a recent a grant approved for some of the engagement work with women in rural communities. So one of the ways we're addressing it is about having understanding where there are other sources of funding and how we can support specific pieces of work. So that's been proving quite successful. And then, of course, we're in continuous dialogue with our partners across the system around what the art of the possible is, who can offer expertise, who can offer resource and that kind of thing. So, but particularly from a VCSE sector and from a primary care perspective, those 2 centres, those 2 areas are particularly challenged at the moment around access to funding.
Okay, thank you. Just a sort of further question. What data is driving the priorities of the collaboratives? What role does public engagement have in that?
Sure. So the collaboratives are based on 3 kind of what we call legs of the stool, or our golden triangle. One sort of element of that or leg of that is absolutely data. And so we're using our population health methodology. We're using all of the tools that are now available through the ICS data population health systems like our Where to Look system and the other one through there. We are, of course, using a lot of public health data, so the JSNA, the needs assessments, fingertips, all sorts of things. So, and for each collaborative that establishes, we also ask other organisations to share their own data and insights. So as we start to look at the outlying areas and start to sort of gain that aspect, we really do take a data-led approach. And that's been really interesting how groups have been driven by that. One of the other legs of the stool is feedback from communities. So part of the big chunk of the health inequalities funding has been to help us develop and refine the engagement model when you're working in this kind of way, because we did learn some lessons previously that this needs a slightly different approach to traditional models. And so we're very much working under the principle of we don't design any intervention without engagement of the local communities, and they are very much part of it and driving it for themselves. And then the third leg of the stool, so to speak, on this is feedback and insights from colleagues and people working in that environment as well. So what does our data say? What does our feedback say? And does that match with the experience of people who are working to meet the needs of individuals in that space? So we look at all of those three things together, we cross-check, we cross-reference, and we make sure that those things are telling a whole picture before we do anything and make any decisions about what we do and how we do it.
Great, thank you. And a final question for me, I promise. The aim is to have a collaborative in each of the 13 primary care network areas. Is that deliverable?
So I think based on where we're at in terms of the enthusiasm and the progress we've made, yes, I think Salisbury is an interesting example. So there are 5 PCNs working in that area, and they've actually all expressed a desire to work together. So, and that's the basis under which we've stepped forward with the livestock market. So we may have one kind of super collaborative with subgroups in that space, but also I do need to be very mindful of our ICBC provider and contract starting this year, and we're still working through a lot of the model and how the approaches are going to work together and align, because we do obviously want to make best use and in that space too. So I think they may end up looking quite differently to the way that they were envisaged sort of 3 years ago. We have to recognise that. So I think, but we will have groups and integrated neighbourhood teams and collaboratives working in each of our areas at the right scale in the right way, and that might look differently from one community to another, but it will happen over 25.
Great, okay, thank you. Any further questions? No, in which case, Emma, thank you for your time this morning. Thank you for the update. And I'll propose a resolution that we receive an annual impact report on neighbourhood collaboratives, if the committee would find that helpful. And thank you again, Emma, for your time this morning. Can I have a seconder for that, Gordon? Thank you. Any objections? No, that's moved. So we'll move on. Thanks for your time again, Emma. To item number 10, Introduction to Wiltshire Pioneers, pages 47 to 84. Members will recall that this item emerged from our discussion on the service users contract back at in our November meeting, and members were interested to receive more information about the Wiltshire Pioneers project. So here we are. We welcome learning more about the project and the difference that the project's making through co-production. And to present this morning, I believe we've got Mary Reid, CEO, and Abby Jo Lawrence from Wiltshire Centre for Independent Living, and Dan Wilkins, Head of Transformation and Quality at Adult Social Care. So I'll hand over to you three to present, and then we'll open up to questions. Thank you.
Oh, there you go. Hi. Yeah, thank you, Chair. As being said, I'm Dan. I'm the Head of Transforming Adult Social Care. We have Abby Jo Lawrence, who's the co-production lead for Wiltshire SEAL, and then we have Mary Reid, who's the Chief Executive Officer. Next slide, please. So, in terms of what we'll be talking about for the next 10 minutes or so, the idea around working more closely between staff within Wiltshire Council and people who use services was an idea that was that came from Mary and has been developed with Wiltshire Council and Wiltshire SEAL over the last 12 months or so. The the focus of the work is how do we ensure that the people in Wiltshire who are accessing adult social care can live the lives they want, and how can we work in partnership? So it really reinforces that co-production approach of working together. And that this is a real kind of key driver of the Innovators and Pioneers project. So the co-produced vision, which we talked about in a few slides' time, that was a key essence of this. We want to look at kind of the small changes that can have a big systemic impact, rather than looking at the massive what do we need to do and kind of getting bogged down by that. So the one of the approaches of working with the Innovators and Pioneers has been let's look at what we can do, you know, in a reasonable time scale. Let's look at how we can work together. The project went live in February last year for initial 12-month proof of concept. We have currently 6 core pioneers that work very closely with myself and the Innovators. The Pioneers Network is part of a wider network of 100 or so pioneers, so there's a good reach from the work that we're doing with Wiltshire SEAL. We have staff working within adult social care called Innovators. There are currently 35 innovators within adult social care across the breadth of the services as well. So that's really important that we're getting equity of approach. And I say in terms of you know, transforming adult social care, we've been working within that. So hopefully people are familiar with the Wiltshire SEAL acronym on there. What you might not be familiar with is Ask About Task. Task is transforming adult social care, and that's been a really good branding vehicle to raise awareness around what we're doing. So I have pens, I have badges, we have other way of communicating this, and that's been really important so that staff feel engaged with the task programme.
Hello. So when we were designing this particular project, it was really important to us as a disabled people's organisation that we did true co-production. You're probably familiar with this. You'd have seen it as a ladder. It's been around for many, many years. So where we're trying to get to with the pioneers is doing with, so not consultation, not telling people what they're doing, but people coming together as equals and as equal partners in a space. We often joke that lanyards were banned from any of our meetings and continue to be banned. And that's because we wanted staff and people who use adult social care to just turn up as their whole selves. And what's interesting is a lot of your staff turned up with lots of lived experience of being a carer, being a disabled person, you know, so we all come with lots of stuff. We're not just Wiltshire Council workers. So next slide, please. So there's a lot of thought gone into how to do this work. So one of the things we draw upon a lot is business change models. So we've used things like how you spread change, who you work with. There's the change curve. So when we talk about innovators, we worked with people who showed up and wanted to be part of this. We didn't choose. We used one of our sort of key tenets was the people in the room are the right people in the room. And that's because often you can get stuck with this kind of work where you're trying to do it perfectly from the start. Wiltshire SEAL uses the motto, don't ask for permission first, ask for forgiveness later. And that's basically what has fueled this work. Another thing we wanted it to be is hopeful. It's very easy for people who have been traditionally called service users and Wiltshire Council staff to sit in a room and be negative with each other and talk about what's gone wrong in the past. So when we co-produced our vision, we asked people to come along and acknowledge that not everything is perfect in our systems, but what would we want to co-create for the future? So what that means is we're in it together. We had the power to change. And as Dan said, lots of small actions leading to bigger changes within the system. So we weren't looking to change adult social care overnight. We more were looking for people to feel really excited that it could change and they could live the life they wanted to live in Wiltshire. So if you see at the bottom there, our foundation principles, we've used things like joy and having fun and it being very person-led. And this is all intentional because we really wanted people to feel energised by the change process rather than feeling powerless.
we met people everywhere. So we had, I think it was 6 events across the county. They were very lively events, they were good fun, but we know not everyone wants to turn up at an event to co-produce a vision. So we also have WhatsApp groups, people can do surveys, people can email us, carrier pigeon, it doesn't matter. We will use any communication strategy that people want to use. In the past, we've stood in shops and talk to people, but it was very much about going to people rather than expecting them to come into Wiltshire Council.
Okay, next slide, please.
Oh, sorry, Abby. This is Abby at one of our visioning events. As you get, we had a crisp wall and everything. So but it was intentionally fun and energetic. Sorry, Abby. And the next slide. This was the vision that we created at the end of this. So after the 6 events, we asked lots of people to talk about what matters to them. A question we often use is, what does a good life look like to you? And we built from that. And it isn't rocket science, it's really straightforward. But what we wanted this to be is like a North Star for this work, so everybody could work towards it. And we brought this vision together in about half an hour after looking at all the stuff from the visioning events. And one of the things that Wiltshire Council staff got very excited about, and we did too, is the use of the word love. Because I think often when you think of strategies and things, they can be very dry, but actually we all want the same things in life. We all want to have relationships that are real and feel like we have value in our community. Too happy.
Thank you. Next slide. So yeah, we spoke about the pioneers and innovators, and Dan and Mary spoke about the relationship between the pioneers and innovators. I just want to elaborate on that. So we got ways of communicating with the innovators. So we got a WhatsApp group. So the WhatsApp group is for the pioneers and innovators. So it really opened up that communication and puts everyone on a fair level, and a lot of great conversation in that WhatsApp group, sharing stories, sharing what's going well, what we need to work on. So it's really important that we had this open communication with the innovators and pioneers. Okay, next slide, please. So this was our first ever innovator session. I think just that photo just shows like the enthusiasm and the amount of people who turned up. And they turned up because, like Mary said, they wanted to be there. And you can see in the middle there is a blow-up man. But this is what our sessions are about. We make them fun. We make them inquisitive. People want to come along and find out more. Okay, next slide, please. Yeah, done. So this is just looking at the progress of what we've done. Bearing in mind, like Dan said, we've only been doing this work since February. We've come a long way, and actually a lot of the work streams was teams coming to us and asking for the pioneers to look at their work and look at things within their service. I think for us, the platform was a massive celebration for us. We worked really close with the Fab team who were wanting to make changes within their team, and we looked at the form and co-produced a new Fab form with them, and this had, like, the feedback on this have been amazing from people using this new form, finding it easier to fill in, not finding it like an ogre, which is what we've had feedback on. We have feedback about the team not being very friendly, and the team were really put out by this, and they're like, we're not like that. So we worked with them to get themselves out there and to really introduce themselves as a team and show people that actually this platform, it doesn't have to be scary. There are people to help you. And like I said, this is just from pioneers and innovators meeting up over a couple of sessions and having a conversation. Okay, next slide, please. So this is just a bit of feedback from some of our innovators. I think there's just one on here that I really want to pick out, and it's about reminding social workers and workers of why they become a social worker, and like really taking them back to why they joined up to do social work. And I think with the systems and things, they will fully admit that they get lost in that and forget about why they're really doing this work. So we've had some really personal feedback that really made the innovators think, why am I here? What am I doing here? And then just getting them to think back to that. Okay, next slide, please. And the pioneers. So I work very closely with the pioneers, and we have constant communication with them. And just one story that really struck us was a young pioneer in the 20s who had been in the system for 15 years. And she said this is the first time she felt listened to. This is the first time she said she sat in a room with professionals and say, I feel listened to and I feel like we're making change. So I think that just goes to show what impact this work has, and in such a short time, the impact it's having on people already. Okay, next slide, please.
So in terms of impact, we're currently working with Professor Matt Jones at University of West of England. We have a relationship with him already at SIL, and we're hoping to go for external research funding to properly evaluate this, because he sees it as good practice in co-production, and it is being recognised as that nationally. But he helped us with a very sort of quick and dirty initial evaluation of the project last year. And these are the sort of 4 themes, and within your pack, you've got the case study, so you can see the detail in there. But it's interesting because it touches every bit of the social care world. You might say, well, I've never heard of this, and you might well be right. It's small. I've got 2 members of staff working 1 day a week on this, and Dan is fitting it into the task stuff. If you haven't heard, just get in touch. Everyone can be a pioneer. All we want is interested people who believe that change can happen. And the final side is just some of our brilliant pioneers that you can see there who've been part of this and who drive us every day. Thank you very much.
Brilliant. Thank you all for that presentation. And I'll open up to the committee for any questions. No? No questions. That is the sign of a brilliant presentation that you've... just bring in Claire, and I know Jane would like to come in as well.
Yeah, thank you. It's an excellent presentation and really inspiring to see this positive way of working. I think my question, please would you come back and let us know how things progress, say, over the next year, because obviously it's fairly early days, and like you've acknowledged, the impact of this work is where the value comes from. So yeah, I look forward to hearing an update. Thank you.
Sorry, can I just add, we're also working with your children's services, and they're, well, imaginatively called the Young Pioneers, but actually they are all just one group. And we have just received quite a lot of lottery funding to evaluate that as well, amongst other things, having life connectors, and we're starting an ambitions club to sort of really change how people see disabled people in Wiltshire. But so it will be watch this space, because there's going to be a lot going on in terms of this area.
Tom.
Yeah, I just really wanted to, well, first of all, thank you for a very interesting and informative presentation, and really quite forward-looking, I think, in what you're doing. But my question really was, are these organisations established in various towns within the county, or are you currently operating purely out of here, out of Trowbridge?
So Wiltshire covers the whole of Wiltshire. It's not so much organisations. Our meetups can be anything from 3 people meeting for a coffee to people sharing stuff on WhatsApp groups, and it's happening across Wiltshire. Yeah, so we're trying to cover the whole of Wiltshire. It's limited resource, but I think, you know, the thing with this is it's self-owned spread, so groups can sort of self-organise, and we'll just try and support them as much as possible. But what we try and make it is bureaucracy light. So there are very few processes in this, and it's in order to people feel that they've got permission to be the change, rather than think they have to sort of, you know, comply to rules, or, you know, come to meetings like this and things like that. So it's very much about empowering disabled people to do things that matter to them. Oh yeah.
So what we're working out over past years, people will only get involved if they're interested in what's happening. So we are really driven by the pioneers to what we work on within services, because if we get too bogged down with systems and things that don't directly impact them, you lose the momentum and you lose interest. So we're really driven by people to what work we do.
If I may, Chair. I think the point I'm trying to get at here is, should area boards be involved with this as a means of spreading the word of what you're doing?
Yeah, that would be brilliant.
And if so, do you have plans to, I accept what you're saying about people wanting to be interested in getting involved in this, seeking the help, but is there a way that we could publicise what you do a little more within our communities? And, you know, to my mind, I think maybe area boards are probably the best conduit into the communities in the county. Just a question.
Yeah, I mean, well, we've had initial discussions with Dave Redbone from Leisure around this, because, for example, for Abby, who we spoke, not this Abby, the Abby we spoke about previously, yes, she uses adult social care, but she also can't get down her pavement because of the brambles. So in her power chest, that means she's stuck at home in her village. So it's life is full of lots of little things that need addressing, not just seeing things in silos. As systems, we put things in silos. So we would love to do more with the wider community. And it builds on the work many moons ago we did in Tidworth around creating the kindness capital of Wiltshire. Yeah. So it is around building on that sort of strengths-based community, finding really quick and easy solutions to change their worlds, really. Sorry, Dan.
Can I just add to that, if I may? So, yeah, so part of the broader work we're doing with transforming adult social care is how do we have a one council approach to this? So Mary's talked about we're engaging with Dave Redfern, but it's very much how do we, you know, the change within an adult social care will have a wider impact. So we're looking at how we can engage in that. And Dave has come and he's met the pioneers. He came to a meeting in December, and part of my work is working much more closely with Dave and his managers to make sure that we are capturing this, because, say, it's broader, the change can be broader than just adult social care.
I'd certainly welcome you guys coming and presenting at the Cairn Area Board at some point in the future, please.
Thank you. David, I'll come to you, David, and then Jane, you can sort of sum up. Yeah.
Thank you very much. I'm just interested in to what extent this is a national role model and leader, because I think, you know, what you've shown us today is that there is consultation and consultation, and this is the best consultation you can get. You know, we were complaining earlier about lack of consultation on a different issue. Then you do get organisations that do consult their stakeholders, but perhaps they do it quite superficially. This is really deep listening, and it's the kind of thing that leads to real change and the right changes for the right people. So I'm just wondering if there are, is this happening elsewhere? If not, are there plans to publicise it so that other people can learn from it? Because I think it has applicability right across the public sector.
Thank you. Well, that's why Matt Jones is interested in this, because he's trying to do work around social care transformation in Bristol, but we're also linked in well nationally. So with Social Care Futures, for example, we're also using this strengths-based positive approach. And we've got quite a few universities interested in us at the moment, which says that they want to use it. We believe this is proper co-production, you know, this is, and it's a term that's used a lot, but unless you're doing with and not just listening to. It's not proper co-production. And I think we're really lucky in that one of our trustees is from the King's Fund leadership team. So he's been able to tell us all about coaching techniques we can use, such as humble inquiry. So it's all about listening first rather than broadcasting.
If I may, Councillor, as well, something as well that's key about this is Mary and I have had lots of discussions over the years around let's not go out again and ask people what the issues are, because we kind of do know those. We know the systemic issues, and what's been exciting for me personally, as well as professionally, is actually we're not asking people what the issues are, we're asking how can we resolve it together. And whilst that's a nuanced difference, it's quite a key difference, and I think that's why this particular project is getting such momentum, because one of the key words that the pioneers are saying is trust. They believe that we've regained their trust, and I feel trust is something that's easy, it's quite difficult to get back, but we've developed that, and I think for me it's like the heart and soul of this. And we have presented this at we were at a national conference last year at Community Care Live, which is for social workers and occupational therapists. So we have presented the work there as well. So I think we are kind of banging the drum for Wiltshire in terms of this is some good stuff.
Yeah, I would urge you to plan to do that more.
Thank you.
Jane.
I just popped up because I just wanted to say the warmest thank you, Mary, Abby, Dan, all the pioneers. Thank you ever so much for everything that you give us. It's absolutely brilliant. I'm really, really not surprised, but really pleased to see the warm reception from the thing. I do have one ask is, could we all have ask about task pins, please? Because I think, and again, that's another way to spread the message. If people go, oh, what's that? And it reminds us, transformation in adult social care, change is possible. We're all part of it. We make the change, and it's just fantastic. Thank you so much. Thank you.
Okay, 12th of March. Thank you all very much for an excellent presentation, and we look forward to hearing more about it in the future. Thank you. So I will get myself back on track here. I guess I've lost my place. Yes, I'll just move a quick resolution that we thank Wiltshire Pioneers for their innovative work in co-production and ensuring the needs of people with disabilities are central in the delivery of services, and that we would very much welcome a future update perhaps in a year's time for the next committee. Could I have a second for that, please? Yes. Thank you. Thank you. No objections? None. Thank you very much. So let's move. We move on then to item 11, non-elected, non-voting, co-opted representation and health select committee. You will not get a snappier title for an item than that. The committee had a preliminary discussion on this subject back in September 2024. We very much value the insight and expertise that is brought to the committee by co-opted members. And the aim highlighted by the report is to formalise the role of non-elected and non-voting co-opted members on the committee. So the draft report and protocol has been submitted for the committee to approve, or indeed amend if you wish. And the intention would then be to introduce the new approach in the next council, so under our successor committee. So have you all had an opportunity to review the suggested approach, and are there any amendments or suggestions or questions? David half put a hand up. Yes?
If I'm reading this correctly, we've got 3 organisations whose names are actually called out as having co-opted members, and then there would be 2 others. Is that? But there's no organisation earmarked for that. So I was wondering how that would be decided.
Yes. So in terms of the other items, so part of this arose because we have Irene, who had been a representative for Healthwatch Wiltshire, and she wanted to stay on the committee with that role having expired, and we felt that she brings a lot to the committee. The Healthwatch contract had expired, but Irene was very keen to stay engaged with the committee. She brought quite a lot to it. So that's why I think we've introduced this element of flexibility with those 2 vacant, if you like, or non-assigned, non-formally assigned places. And in terms of process, and Julie will correct me if I'm wrong, but I think annually it would be reviewed and agreed at the start of the committee's year, if you will.
looking at the forward work plan and looking to see if there are particular groups who are unrepresented.
Okay, did you get that? So that annual review would be through the forward work planning thing. Yes, I suppose if you saw that there was a group, there was a bit of work that needed input from a group and they weren't represented, then we'd have that flexibility, I guess, to bring people in. Gordon.
Just like to say that I support the review. I think the paper hits the nail on the head, really. You know, I support the expansion of the committee to from 3 to 5 independents. And I absolutely endorse what you said. All our independents, without exception, have brought such a quality of presentation and insight to this committee, you know, and done valiant service, really. And I think this paper, more than anything else, gives us a tool to take forward, and I would really recommend it to the other select committees as well. Yeah.
Great. No, absolutely, and we can make that point when we bring this to overview and scrutiny management. Okay, if you're happy, are there any further questions? So the resolution would be that we approve the recommendations set out. Do I need to read them out? I can read them out if you wish, but it would add 20 minutes to the meeting. Fine. Can I have a seconder then? Thank you, Gordon. Any objections? None. So that is moved. And we can canter on to item number 12. Forward Work Programme. To review and approve the committee's Forward Work Programme in light of decisions it has made throughout the meeting. So any suggestions or comments from members? David?
I think we just need to write into the top of that the proposal you put forward after the questions about the community service contract.
Yeah, no, absolutely. So any sort of decisions made today will be worked into it, and as you say, we've got that briefing in February with the ICB, and then obviously any further scrutiny work that arises from that can then be incorporated into the forward work plan as well. Fine. So if I could propose that we approve the committee's forward work plan subject to those items being incorporated. Thank you, Claire. Oh no, it's a question. Sorry. Yeah.
I beg pardon, so I'll just turn the mic on. So on page 95, there is one highlighted yellow, urgent care. Do we need to put a date in that one? In the papers, it's page 95, agenda item 12, first page of it. It was to undertake a rapid scrutiny to understand the data collected with regards to urgent care, in particular response time, note to include range of response time and hospital handover. So we did have a presentation I think we were going to do a rapid scrutiny on that, though, weren't we? Was that
yes,
my
no, you're
understanding?
right, we were.
And do we need to put a date
We
for
do.
that?
We haven't had a what's the word I'm looking for? Recruitment notification set
I
out.
would imagine it would have to be a recommendation for the next committee, because we won't have time to do it before March.
Oh, I see. So this is a legacy item, in other words. So it's an item that we would need the successor committee to take up and to establish that rapid scrutiny. Could we not do it?
Well, we looked at some data in November,
Yeah.
but there were some sort of thoughts about what could be potentially improved. My understanding or my recollection, and forgive me if I've got this wrong, was that we would do a rapid scrutiny on what could be better in terms of that.
Yeah, I'm inclined to
forward.
agree. I mean, I don't
And
think
if I've,
this needs
if
to
I've
wait.
misremembered,
No,
then why, but my sincere apologies.
I think you're right. I think this doesn't necessarily need to wait.
And it's probably just a few people getting in the room together for a couple of hours to just.
And may well be as a result of that, they then make a recommendation
Yeah.
for the next committee to take it.
Yeah.
I'd be inclined to agree with that. So I think we should get that set up.
And I think I'd be keen to be on that.
Yeah. No, thank you for flagging that. Yeah, if we could sort of move that forward.
Is anyone else apart from Claire?
Great. It's nice to have people volunteering, because that's normally the challenge of scrutiny, that rapid scrutiny is getting people to actually do it. So, Great. If any other members are keen to be involved in that, please do make yourselves known to Julie. Okay, so in terms of approving the committee's work plan, subject to those changes, had a seconder already, so if we could just, any objections? No? Great, that's all moved. Item 13, date of next and future meetings. Only one of these will apply to us. That's the one on the 12th of March 2025 at 1 p.m. So please note, an afternoon meeting. And then future meetings thereafter for our successor committee would be 5th of June, 9th of July, 9th of September and 12th of November this year. Great. Okay. Thank you all for your input today. There was some good questioning. We'll get a date in the diary for that briefing from the ICB once we've got their written responses and take that item forward from there. See you all in March.
If anybody wants their
Task badges have landed, so please come and take one. Yes. Apologies. So you'll recall item number 6, I believe it was, the Cabinet members' updates. If you're happy to wait for 5 minutes, Jane will just give us a quick update. We're still on.
Hello. Yes, just very briefly, 3 things. The CQC will be publishing our adult social care inspection outcome next week, so please look out for the press about that. Second thing was working on the home care first contract for 2026, and I think, I'll look at George. Oh, you are there. I think we'd like to offer to bring it forward to you for some scrutiny.
And this falls within that big contract we were talking about earlier, doesn't it? It doesn't? No, it's so confusing. This is why we really need to get our heads around it.
This is the Wiltshire-based thing.
Yeah.
And it's something that I think in part we took out of the contract because we wanted to make sure.
That's right. Yeah. So we kept this in-house alongside that larger contract. Alison will explain. Because I think it's really important for us as a committee to understand how all these bits piece together.
Thank you. So no, this is completely separate. So currently we purchase home care for people, well, when we were talking about earlier about our accommodation strategy, so for people to remain in their own homes. So this contract is about that. So it's about how do we purchase care for people to remain in their own homes in the future so that people can be independent as possible. What we have in Wiltshire, which is a really good service and we run it as a council, the council runs it, is our reablement service. And people would receive a reablement service to make sure that people are maximising their independence. That's separate, that's run by the council. The Home First service that is coming into the council will be joined with our reablement service to provide one service. And that's the bit that was part of the Community Health Services contract, but that won't be about this. Is that okay?
Yeah, that makes sense. Thank you.
Okay.
So we have clarity on that. And the final point was to make, we are talking to the Department of Health and Social Care around the pressures that have come into the system. I mean, it's particularly for providers who will have much higher national insurance bills, for example, and they are not covered by the government grant directly to Wiltshire Council. So we are representing those concerns on a national stage. Thank you.
Good. Thank you very much, Jane, for that. Thank you. And I will now bid you all farewell. Thank you.
But we've just got these briefings for councillors who want to have that in Dawson's time. So I think before you forecast that really, and it's just the information that users. What we know from going on in the chair.
Yeah.